Welcome back. You're watching McLaren Port Huron's Today's Health, and our program today is all about treatment options for patients diagnosed with breast cancer. In this segment, we're going to be talking about radiation therapy with radiation oncologist Dr. Matthew Johnson. Dr. Johnson, welcome to Today's Health.
Thank you for having me, Barb.
Can you give us just the basics of what radiation therapy is?
Of course. So radiation therapy is really just the targeted delivery of X-ray beams to a certain part of the body with the intent of killing the cancer cells. And I say targeted delivery because we really only want to treat the area that we think either has cancer or is at risk for cancer. So really radiation is a fundamentally different treatment than when patients either take a pill or take a drug through the chemotherapy through the IV that goes all over the body throughout the bloodstream. The radiation is really only going to go where we point it or where we want it to go.
What are some of the common misconceptions that people have?
So some of the most common misconceptions are, one, a lot of patients think that the radiation treatment is going to be painful, when actually it's the exact opposite is the case. The treatments themselves are just like getting an X-ray or a CAT scan. So patients don't see the radiation treatment and they don't feel the radiation treatment. So really, they won't feel any differently when they come to an appointment and then they leave. And one of the other misconceptions we often hear from patients is they're really worried about being radioactive. If I get this treatment, will I be radioactive? Will I expose people in my family or the community to radiation? And this is also not the case. When we do these treatments, we're not leaving any radioactive sources inside of the patient. So as soon as the patient's treatment is done, there's no more radioactivity in the room, there's no radioactivity in their body. So they're not going to expose anyone. They're also not going to, glow in the dark or anything like that.
Are there misconceptions specific to breast cancer radiation?
So there are, and I think one of the biggest ones is for a lot of patients, they often have to face the decision of whether to have a mastectomy, potentially avoiding radiation, or a lumpectomy with the addition of radiation. And one of the misconceptions we hear a lot about is patients may think that, oh, a mastectomy may be safer, or I may have better outcomes with that, when really this has been studied many times over the past 30 to 40 years, and we've always shown that the outcomes are the same. Now, some patients, because of different characteristics, may require a mastectomy, but in general, when patients are given the decision, we haven't seen any difference in survival when looking at those patients.
Is there more than one type of radiation therapy?
So there is. In breast cancer especially, there are really two types. One is external beam radiation therapy. And this is a kind of radiation that's delivered using a machine called a linear accelerator. And what that does is that takes X-ray beams from outside of the body and points them towards the body or towards the area we want to treat, typically the breast in patients with breast cancer. And this kind of treatment is typically done Monday through Friday, 5 days a week, in a number of small treatments. The other treatment option for patients with breast cancer, which is a relatively popular option in patients who have earlier stage disease, is something called brachytherapy. Brachytherapy is essentially where we use a device that allows us to take a tiny radioactive source and put that source inside the body for a prescribed amount of time to give radiation essentially from the inside out instead of from the outside in, like with the external beam radiation. And at the completion of that treatment, the tiny radioactive source is taken back out, and just like in the regular treatment, the patient goes home. They are not radioactive. There's no source left in their body. And that's really kind of the biggest basic difference is one is coming from outside of the body and the other is from inside.
So how do you make the decision then about which one is best and will most benefit the patient?
That's a good question. Some patients will have really an option, and they'll get to kind of decide after hearing about the different side effects what might be best for them. Now, I can tell you that the Brachytherapy, or what we also call partial breast radiation therapy, has really only been studied in patients with early stage disease with relatively favorable characteristics. So not all patients that come to the office are going to be candidates for this form of treatment.
So tell me about, are both of these available here, and do you have the latest and best equipment available here at the Karmanos Cancer Institute?
So yes, we do have brand new technology having just opened the center, and it is really top of the line. The treatments that we offer, all encompassing, so we do every kind of radiation treatment here. And generally, the patients, once they have their consultation, we will kind of flesh out the different forms of radiation, talk about some of the major differences are for the external beam radiation, where we're delivering the radiation from outside of the body. That treatment is usually given around 4 to 6 weeks after the surgery finishes. The surgeon will do the surgery, we allow appropriate time to heal, and then the radiation is delivered to the breast. And the most common kind of standard treatment is typically the treatment's given Monday through Friday, 5 days a week for about 6.5 weeks. Now, that's with the external beam radiation treatment. Now, with the external beam radiation treatment, there are some patients who will also qualify for a shorter treatment course, and their treatment is delivered in a little bit over 3 weeks by giving a slightly higher dose each day. And we've studied this, and the side effects and the cosmetic outcome of the breast are exactly the same. So again, it's kind of dependent on some of the patient's disease characteristics. It has been studied more in patients with early stage disease. And for brachytherapy, that's an even further reduction in the treatment time. So you can kind of see the general trend where a lot of radiation is moving. Brachytherapy allows the treatment to be completed in 5 days. Now, in that typical treatment, the patient will be coming twice a day during those 5 days. And they will require a device to be placed within the breast, and this is something that Dr. Clark Paul, Dr. Bout, several surgeons in the community already participate with us in performing this procedure. They're the ones who actually place the device after the surgery, and then the patients come in for the treatment, and as I mentioned, there's a small radioactive source attached to a cable. It goes into the breast, it sits there for a prescribed amount of time, usually only a few minutes, and then it comes out, and at their 10th or final treatment after 5 days, we remove the device. And that's really kind of the basics of the two main types of cancer.
Thank you so much for demystifying this whole radiation therapy treatment for us.
Of course.
Stay with us, we'll be right back.